Hello, my name is Dr. Jennifer Lee, and in this video, you will hear from a woman of color and her experience, expertise, and work being in a leadership position in a health department in the South. Centering women of color in our work is vital to ending the HIV epidemic and responding to other health disparities and inequities which persist within women of color communities. My special guest today will talk about how centering women of color knowledge, experiences, and expertise, how to disrupt the status quo, and also provide recommendations to health departments to better engage women of color to end the HIV epidemic. We hope you find this video useful and helpful in understanding how to disrupt the current status quo when engaging women of color communities toward ending the epidemic. I'm honored and privileged to be joined by Angela Littrell. Angela is an executive coach, career strategist, and speaker, using her passion, energy, and real life experience to inform her work.
Thank you for having me. I appreciate it.
Can you speak a little bit about your experience working in a leadership position in a Southern Health Department?
It's very interesting, I will say. Lots of health departments are very traditional. And that's not to say that they're not doing innovative things, but state government in general tends to be antiquated a little bit, takes them a little bit of time to catch up. And that can happen for a variety of reasons, funding and things like that. If you have long tenured employees, a lot of times you will get employees that's where they start their careers. And because of the work, they're dedicated to the work, they stay there and kind of move around and navigate. Many have not worked outside in corporate environments and things of that nature. And so they tend to be a little slow in acceptance sometimes, and depending on who's in other positions, in leadership positions, you can kind of have some of that difficulty as a minority coming into it. Now, of course, and there's two things I like to say about that that make it challenging. If you've had you establish your career outside like I did outside of state government, the health department, and moved around in a corporate environment, you tend to understand the challenges of going in. And so, whereas you will see corporate America tends to give a lot more opportunities to minority women. But when you go into health departments, again, you have that kind of um, a lack of exposure per se, and seeing women of color in higher executive positions. And so when that occurs, it makes it a little, there's some challenge, some very specific challenges in how you're able to interact in that environment.
So, how can we better center the embodied knowledge, experiences, and expertise of women of color communities in ending the HIV epidemic?
Um, so I think, you would have to tie in that cultural perspective. I think a lot of times, depending on where the work is driven from, who's driving that work, sometimes it can be, again, the health department. The health department has a lot of HIV programming and things like that. And again, I think you need to look at making sure that it's diverse enough and that it incorporates the right partners and the right champions. And sometimes, depending on who's driving the initiative, it may not be a person of color who understands the community, right? We talk a lot of times about everybody feels good and everybody wants to help, but there are a lot of times when the people that are again leading those efforts are not necessarily the people who are from those communities. So I think and that that happens for a variety of reasons, but I think whoever is organizing that needs to include the right people at the table from the beginning, because if you don't, you may have some missed opportunities because of that individual's lack of understanding of the community and the population that you're trying to impact.
How can health departments disrupt the status quo to better engage women of color communities from the beginning, like you said, or in lieu of having that at the table?
So one of the things that I love talking about, which when I was working at the health department, um, is I think incorporating from the beginning within the organization. It's a cultural thing within the organization, quite frankly. I think a lot of health departments are trying because of the uh, racial biasness that has come into play or unconscious biasness. There's a lot of buzzwords and talking now around that. I think the whole external environment, with the things with George Floyd and the police and all of that. I know that when I was there, all of that kind of came up. So sometimes it's by the miraculous luck of the spirits, right, and the environment, right, that forces you to have that conversation and to look internally with your organizations, right? I mean, every organization has a cultural diversity, team or HR person that, is responsible for that. But I think we've gotten a little kind of desensitized. That's kind of like your status quo thing. It's really easy. Yeah, we got the program and people hear it, but every now and then you've got to refresh that, right? And one of the things when I was there and we were talking about cultural diversity, I went on ahead because it was an opportunity to stand and interject that. Let's talk about unbiased, the biasness piece. Let's talk about the racial and unconscious biasness, and and that's a hard thing to talk to people about because people in general don't want to believe or acknowledge that they may have some racial um, piece in it, especially when you're working at the health department, especially when you're doing work that you are trying to help people and you're trying to help everybody. We do a lot of community work at the health department. The health department is about communities. But when you're in providing service and you're working on your projects and your grants and your budgets and you're just kind of in go mode. And so one of the things that we said we would start doing as a result of that is we would start doing more self-evaluation around that particular opportunity and making sure that not only are we aware in the community, right, around health equity, but we wanted to make sure that our staff, the staff that helps do the work, that carries out the work in the grants and the funding, that they are consciously aware. Because a lot of times we're going to the community looking for the community, and we've got our own staff that doesn't understand health equity and diversity and how it drives and impacts the decisions and the work that they do as we carry out those activities, right? So we made a commitment that we were going to demonstrate that that not that we value it, but that it was an important factor for Arkansas. Um, and so when we submitted that, we made a commitment that we were going to put that in training. We first were going to start with the training within the department so that all of our staff went through that training. Then we took it to a step further, and then we had the home visiting program, and we work that home visiting program through Children's Hospital, have frontline staff that goes into the home of pregnant women and working with them. And one of the things that we said was, Well, a large majority of those workers were Caucasian who work in a lot of rural areas with minorities. And there are cultural things that you need to know and be conscious of when you're going in someone's home, right? And so we incorporated that and took it down a level, and they will be going through that training. And then what we were planning on doing was, as our staff went through the training, we would get results from that, right? And do a pre-post training. And then we would take it down to the second layer, and then we would do that training. And then what we were planning on doing is taking that data and that information and presenting it to the leadership at the health department to say, look, this works, and we are more successful because of us bringing health equity into the picture from that direction of social, not social, but conscious and unconscious biasness, because we know it exists. We just don't do anything to resolve it, right? And so we were going to present the data to that, and then we were going to have the health department incorporate that into their organizational training and make that a required course. And I was very fortunate that I had a good relationship with the leadership team who trusted me and embraced that, and allowed me to incorporate that in our Title V state plan.
Wow, that is such amazing work. Thank you so much for sharing all of that. I really love how you're talking about like capitalizing on the moment and really looking for these small steps to take but are so powerful when committing to it. So
Yeah.
thank you for that. What recommendations do you have for health departments in the South to be more culturally responsive when implementing their ending the epidemic plans regarding community engagement for women of color?
I think they are making some efforts. I mean, I really do. This is not easy. If it was, we'd have figured it out, a long time ago. Um, but I think just making the commitment and embedding across the organization and the work that you do, and making sure that you have a good balance, in ensuring that the right people are at the table. Most health departments have the Office of Health Equity, that kind of thing, who do their work. But I would like to see that work spread a little bit more across the organization and not just have it in pockets. And I think that's the thing. And I think going into areas and spreading that into other areas that may not be either as comfortable or traditional, but look across those places so you can spread that. I'll tell you, we tend to only want to work with we think diversity and all of that is housed with the Office of Health Equity Diversity or the Minority Health Commission, and so you do these little pockets, and it's like, well, what about, other systems, other areas that we're not even touching? Do more with faith-based communities, where people are, and find those places, hunt them out, seek them out, because they're there. I'd even challenge to work with other cultures, um, to that help support that work, and can help with that spread a little bit more. You know what I mean? Because it's very intertwined, and if we bring more in, I think that will help with the momentum, and getting it is spread out. But we've got to get out of these pockets of places where it traditionally sounds good, where it fits, and challenge ourselves to look and find those other opportunities. Just making sure that as we move forward and we're looking for new opportunities, that we don't forget that part of looking for new opportunities, when we are developing strategies and things like that, that you have an equal balance of leadership representation of minorities in that, because a lot of times you may have, I'm just going to be honest, you may have 5 or 6 leaders working on the strategy and you have 1 or 2. Most of the time it's 1. And I know for a fact, because a lot of times I've been the one in the room, and I'm just like speaking for the whole body of my, my people. And I'm grateful to be in that position, but that shouldn't always be like that. We're in the 21st century. We should have more minorities when at the table when we are developing that. And um, it's a very uncommon thing in the South, unless it has to do something with uh, diversity and health equity, right? Because you're forced to have because that by then that's when you're going to the office. If the Office of Minority and Health Equity is leading the effort, there will be many minorities at the table, right? Because that's their area of responsibility. But you have all these other projects and work groups and things that go on, and then when you walk in the room, there's only one. So, don't just rely on that one organization. We tend to, when we make small steps, we say hooray and we clap, and then we kind of move on to the next thing and not make sure that it's living. So what we found is we've made progress. Lots of minority women, I will say, are in more leadership positions, depending on what department you work in and all of that. But COVID has impacted women significantly. I mean, you go back and do the research. Anytime we have an economic impact that has job loss, whatever, it's us. And it hurts because to be consciously aware that you were always last, no matter how hard you work. And it may be for you, me being successful, I'm happy about that, but I'm hurt because I've got sisters that are behind me that can't get a foot in the door. They're always digging their way out because something environmentally is happening to them because of their class or where they live or, or whatever. We're always last. I mean, we're last in healthcare. We're always sick. We're diagnosed with all diabetes and all this, so we're sick all the time. The latest thing that I had to work on while I was at the health department was we have the highest death rates of pregnant women. We die more during childbirth than any other race in the United States. So, when we're talking about minority women, it's deeper than just position and leadership. And we still have a lot of community things that just impact us, and we just every time we get our head above the water, we just kind of feel like I can't make it. So when I have women who reach out to me and want to be coached, that's what they talk about. I'm trying to get promoted on the job. Well, they're blocking me from doing that. Or if I'm if I'm speaking too much and going against the grain, then I'm targeted and then I'm blocked from, getting in that leadership position. There's just a whole system that sisters talk about behind the scenes to each other, that I don't think the general public has an understanding that there are systems that are supposed to be there to help you, but they really are roadblocks, And so we've got a lot of work to do um, around that and trying to help really figuring out how minority women can finally get ahead. So I think we have some work to do, but I think the work that you're doing and this and having those conversations and again getting people to hear and listen and be reflective of that and making commitments to what they're hearing and learning and being conscious about it is going to help. It's going to take a long, long, go a long way.
Thank you so much. You're so amazing, and we're so grateful to have
Oh,
you.
thank you.
Thank you so much. And
Thank
just
you.
want to say, as women of color, we're here, see us, hear us, uplift us. And, what a great opportunity to speak to someone with so much knowledge and expertise and passion for this work. So thank you again. And
Thank you. Thank you. I'm glad to have enjoyed it.